Sure. My name is Bob Ritter, and I'm the author of When Your Life is Touched by Cancer, practical advice for patients, professionals, and those who care. The book is really a compilation of newspaper columns I've written over the last 7 years about living with cancer. I've been doing this work, and people often ask me questions about cancer, like, what questions can I ask my doctor? What should I tell my kids? What should I tell my parents? And I often found that many of the questions were universal, that could and should be shared with other people. So I began to write the column to address some of those common questions. And I found that people like to have conversations about cancer. If you have cancer, sometimes it really is, the elephant in the room. And it's important to talk about it. That the more you talk about it, the less scary it is. And sometimes people don't know what to say to a friend who has cancer. Should you ask about their cancer? Should you not say anything about the cancer? And people feel awkward. And also, a lot of the book is about keeping the patient in charge. I find that when you're diagnosed, lots of people give you advice. They tell you, you should do this, you should see that doctor, you should go to this hospital, you should have this treatment. And people get overwhelmed with advice. And I really try to bring things back to the patient and say, well, what do you want? And I really want the patient to be in control. I often see this with families. And sometimes I hear from middle-aged friends who tell me that their mother was diagnosed with cancer and their plans are to take their mother to this hospital in this city to talk to this surgeon and have the whole treatment plan. And then I ask, well, what does your mother want? And there's usually this pause, and I realize they never really asked their mother. And they're making lots of assumptions as to what their mother wants, what's best for the mother. And if I do nothing else in this book, it's to ask the person with cancer, what do you want? And I've learned there's no single right way to do cancer. People have different paths, people have different attitudes, have very different perspectives. What makes sense is to figure out what's best for you. I really like people to make informed choices, to realize their options, to think about their options, realize the pros and cons of them. But once they have, the information, what decisions they make, it's their choice, and they should feel comfortable in those choices.